Thank you. Thank you, Chair Fox and Ranking Member Scott, for today's hearing. Secretary Becerra, my friend, we miss you, but it is great to see you today. Congressional Democrats, with the help of HHS, have been working to expand access to quality and affordable health care. Florida led the nation in Obamacare enrollment for 2023. More recently, I have successfully fought and gotten resources to build new clinics and expand access to primary care and dental care for children in my district. I have proposed legislation that places a registered nurse in every school and provide additional resources for HIV and AIDS patients in Florida. These actions all demonstrate Democrats' dedication to accessible health care. I look forward to working with you, Mr. Secretary, to address health disparities, a woman's right to choose, the nurse shortage, COVID services to our underserved minority communities. And I want to extend an invitation to you to come visit Miami so that we can work closely together. I would love to have you. So that's on the record. With that, I have a few questions, and I have so many questions, I'm going to ask them all and let you answer. Okay, how about that? How are you working to protect 340B programs to ensure community health centers can continue to serve our communities with the end of the COVID funding? And Medicaid redetermination, can you work with our state to improve the process and address the Floridians who lost coverage because of their redetermination? COVID funding. We have a group in Miami led by Dr. Dwight Reynolds. It's called Centers for Health Promotion. How can HHS help this coalition continue their work to provide COVID-19 vaccinations, treatment, and education to the African American community in South Florida? And gun violence. Gun violence has been the #1 killer of black men and boys between the ages of 15 and 44. In 2006, gun violence became the #1 killer of black children. And now, gun violence is the #1 killer of all children. What is HHS doing to address gun violence? Then health disparities in black men. What is HHS doing to address these preventable health issues for black men? Heart disease, stroke, and other preventable illnesses. And also in 1978, there were 1,410 black men in medical school. Now there are 690. And has your agency worked with the American Medical Association and NMA to address this disparity? Thank you. I have some more, but I'll run out.
Congresswoman, let me do the best I can to try to respond to as many of those questions as possible. But first, I will respond to your comment, and I publicly can say to you, I look forward to being in your district and meeting with folks who are desperate to make sure that we continue to offer them affordable health care, quality affordable health care. So I look forward to the invitation to come visit in your congressional district. 340B, as you know, it's a critical drug discount program for safety net providers. Without the 340B program, a lot of those community health centers that offer tremendous services would not be able to make reasonably priced pharmaceutical drugs available to so many people. And so we understand the importance of it. It's a big tug of war right now. I know you know this, and we're going to do everything we can to enhance transparency in the way those middlemen operate. We want to make sure that those who are operating these 340B programs and determining which health centers are able to get access to the 340B program are doing so in a way that complies with current law. We also want to make sure that any of the savings that are being generated by the drug discount program are actually going back to the American people, and so through lower priced drugs. And so there's a lot of work we need to do there. But as you know, many of those who operate in this space use the courts to try to protect themselves from full disclosure and transparency. So we're going to do what we can. The president's budget does propose an increase, $17 million, so about a $5 million increase to be able to actually strengthen the program's operation. Redeterminations on Medicaid, I hope we can all work, every member here can work with us. We just sent out a letter to every governor in this